We are starting a battle. Maha is shedding a light on the very dark underbelly that is mainstream healthcare. This is the perfect time for people to awaken to the failures of mainstream healthcare and to demand real solutions. This isn't just a story about what's broken. This is a rally cry for real change. So imagine a time when healthcare is as diverse as the people it served. In the early 20th century, America's medical landscape was a patchwork of natural healing traditions. It was homeopathic remedies, herbal treatments, and innovative practices were taught at a variety of medical schools, including those serving the African American communities, even at that time. Medicine wasn't just about treatment, it was about understanding the body's natural ability to heal and fostering a connection between the patient, the practitioner, and really nature itself. But that all changed in 1910. It was the release of the Flexner Report. It was commissioned by the Carnegie Foundation and heavily influenced by the Rockefellers. This report, under the guise of standardizing medical education, became the tool that reshaped and ultimately captured American medicine. It targeted schools practicing alternative and holistic healing, labeling them as unscientific and unworthy of accreditation. The report recommended shutting down nearly 90% of the medical schools, disproportionately impacting schools serving African American communities and really anybody that was teaching natural medicine. But why? Because the new vision of medicine required control over education, control over practice, and most importantly, control over profits. The Rockefellers, who had invested heavily in pharmaceuticals, wanted to create a system where all paths led to their products. By funding the creation of the American Medical Association, the AMA, and aligning it with the Flexner recommendations, they ensured that allopathic medicine, treatment centered on drugs, surgeries, and symptom management would become the standard. This was the birth of the medical industrial complex, a system designed not to foster healing, but to generate revenue. And the AMA became the gatekeeper, insulating the industry from any accountability. By controlling licensing and accreditation, they ensured that alternative approaches were marginalized, they were dismissed, and ultimately forgotten by the mainstream. The fallout from this was devastating. Natural remedies, which had been passed down through generations, were now considered fringe. Entire schools of thought that prioritized prevention and root cause healing were shuttered. Communities, especially the African American communities, who relied on these methods were left with fewer resources, funneling into a system that didn't prioritize their needs. The holistic view of health, which had been the cornerstone of medicine for centuries, was replaced with a mechanized, one-size-fits-all approach. This wasn't just a loss for the medical community. It was a loss for all of humanity. What had once been a collaborative, diverse field of healing became a monopolized system where innovation was stifled and profit reigned supreme. As the Flexner Report laid the foundation for monopolizing medicine, a new, even darker era emerged, one marked by corporate greed and government complicity. The very system designed to protect public health became a revolving door between big pharma executives and the regulatory agencies tasked with overseeing them. And the result became a healthcare system riddled with conflicts of interest and a population increasingly burdened by chronic disease. Let's start with the FDA, the Food and Drug Administration. On paper, it exists to ensure the safety and efficacy of drugs and treatments. In reality, it's heavily influenced by the pharmaceutical industry. Many FDA directors and high-ranking officials come directly from Big Pharma. And after their tenure, they return to a lucrative position in the same companies that they once regulated. This revolving door ensures that the interests of corporations, and not the public, not us, are prioritized. The corporation doesn't just stop there. Medical journals, long considered the gold standard for scientific research, have been co-opted. Pharmaceutical companies fund the majority of studies published in these journals, skewing the data to favor their products. And when negative results surface, they're often buried. It's leaving doctors and patients with an incomplete and often misleading picture of the risks and benefits of treatment. Here's a sobering statistic. 1/3 of all FDA-approved drugs are eventually pulled from the market or receive severe warnings due to safety issues. Just think about that. These are the same drugs that were once deemed safe for the public, now pulled from the shelves. This cycle of profit-driven medicine has given rise to an epidemic of chronic disease. Heart disease, diabetes, autoimmune disorders, and obesity have skyrocketed. And it's not because we lack treatments, it's because the system thrives on managing symptoms rather than addressing root causes. So why cure a disease when managing it creates a lifetime customer? Meanwhile, the mainstream media, which should serve as a watchdog for public accountability, remains eerily silent. And why? The answer lies in advertising dollars. The pharmaceutical companies are the largest advertisers to major media networks. Exposing the failures of the healthcare system would mean biting the hand that feeds them. So instead, they perpetuate this narrative that the system works, and that the problem lies with the individual, and that the solution is always just another pill away. And it's not just the media. Politicians on both sides of the aisle benefit from these massive campaign contributions coming from pharmaceutical companies and healthcare conglomerates. These contributions ensure that legislation designed to challenge the status quo rarely see the light of day. It's a web of influence that extends from Washington to Wall Street, leaving the average patients like you and me and healthcare providers just trapped in this system that's prioritizing the profits of these corporations over the people. So what's the result of this? It's an explosion of chronic illness. It's mistrust in healthcare. It's a growing sense of despair among those who see the system for what it truly is. But here's the truth. This is not an accident. This is by design. Chronic disease isn't just a health crisis. It's a business model. But there's good news. People are waking up. The cracks in the system are becoming impossible to ignore. The demand for transparency, accountability, and real solutions has never been greater. Functional medicine and alternative approaches are no longer fringe. They're becoming a lifeline for those disillusioned with this mainstream narrative. Functional medicine plays a huge role in reclaiming the health of our nation. The system is broken. There's no denying that. But here's the incredible news. The tide is turning and turning quickly. Functional medicine professionals like you are uniquely positioned to lead this movement. Let's start with what makes functional medicine so powerful. It's not just a treatment method, it's a philosophy. It's about addressing the root causes of illness, not just masking symptoms. It's about seeing patients as whole people and not just a collection of diseases. And that's exactly what people are searching for right now. The Make America Healthy Again movement is shining a spotlight on this need for change. It's creating a once-in-a-lifetime opportunity for functional medicine professionals to step up and lead the charge. Look around. The awakening has happened. COVID-19 cracked the system wide open. It's exposing the flaws for the entire world to see. And it starts with America. People questioned why natural immunity wasn't discussed, why life-saving alternative treatments were suppressed, and why so much of the narrative was driven by fear rather than empowerment. Voices like Dr. Robert Malone, Dr. Peter McCullough, and others dared to speak out, challenging the status quo and giving people hope that there is another way. Even cultural icons like Joe Rogan, Elon Musk, they've amplified these conversations, bringing them into millions of households who wouldn't have normally heard about this. Rogan, his willingness to ask hard questions about health, fitness, and medicine has sparked curiosity and skepticism in people who once trusted the system without question. And then there's Elon Musk, whose acquisition of Twitter and the release of the Twitter files, completely pulled back the curtain on just how controlled these narratives have been. These events have created a perfect storm, a moment where truth is finally breaking through. But here's the amazing thing. This awakening won't lead to change on its own. It needs leaders. It needs professionals like you who are ready to step up into the spotlight and provide a solution people are desperate for. Functional medicine isn't just the alternative. It's the revolution, and it is happening right now. This is where you come in. You have the tools, the knowledge, the passion to make a difference. But to truly lead, people need to know who you are and what you stand for. That's why having a strong online presence is no longer optional. It is essential in this battle. Patients are searching for you, for your expertise, for the answers that mainstream healthcare has failed to provide. But if they can't find you, if your voice is just lost in the noise, that opportunity is going to pass you by. So imagine this. Your practice could become the beacon in your community. You're not just helping patients, you're leading a movement. Families see you as the provider who helped their loved ones reclaim their health. Your practice grows, your impact expands, and your voice becomes a rallying cry for change that is desperately needed in our country. This isn't just a chance to grow your practice. This is a chance to become part of something bigger. This is a chance to take back what was lost, to restore the natural root cause approach to health that the Flexner Report tried to erase. Functional medicine professionals are the key to a healthier future, and that time to act is now. The tools are here. The momentum is building. The patients are ready. And the question is, are you? I want to leave you with this. Functional medicine professionals are standing at the edge of a turning point in history. The opportunity to lead this movement, to challenge the status quo, and to restore health to America has never been greater. Now is your time to rise. And we here at Honorable Marketing are here to lift you up.